everyone. Today we'll discuss the additional first trimester ultrasound markers for the chromosomal abnormality in trisomy 21. Basically, the first trimester ultrasound markers which have been reported in associated chromosomal abnormality include the absence of, first is your absence of nasal bone. Okay, the absence of nasal bone. Second is your reverse AOF in the ductus venosus, and third is your tricuspid regurgitations, and fourth is your frontomaxillary facial angle. Okay, so if you take the point 1 is your 4 is your absence for first trimesters soft marker, absence of nasal bone. Second is your reverse A wave in the ductus venosus Doppler, DV Dopplers. And third soft marker is your tricuspid regurgitations TR. And the fourth one is your fronto maxillary facial angle. So these are the 4 soft marker in the first trimesters. Okay, these are the 4 soft markers in the first trimester. You can see these are the absent nasal bones, and known as this is the first, that's the nasal bone is absent. This is the absent nasal bone. Okay, nasal bone is absent here. Okay, then this is your ductus venosus Dopplers, a reversal of ductus venosus. You can see how nicely they have given reversal of ductus venosus. You can see this is the reverse, this is the normal ductus venosus, this is the reversals. You can see the reversals. This is nicely written reversals, and reversals. So color Doppler ductus venosus showing positive and reverse A wave, and the Doppler assessment of the tricuspid. From here the tricuspid valve is there. You can see the sample volumes. There's a normal tricuspid flow and the tricuspid regurgitations. Okay, these are the basic. So as the first trimester ultrasound soft marker is absent nasal bone, is your tricuspid regurgitations, and absent ductus venosus AOF reversals, and use frontomaxillary facial angle. The next case, second trimesters at trisomy 21, second trimester soft marker is the ventriculomegaly. First is your ventriculomegaly, and your absent or hypoplastic nasal bone, The third is your increased knuckle fold thickness. Fourth point is your intracardiac echogenic foci, and aberrant subclavian artery, ARSA. Then is sixth is your hyperechogenic bowel. Then seventh is your mild hydronephrosis. Eight is your short bone, that is humerus or femurs. These are the soft marker in the second trimester. So basically, if you start from the brain, first see the ventriculomegaly. Second, see the nasal bone. This is the facial bone. This is absent of hypoplastic nasal bone. Second, then you go to the backside. Backside is your knuckle fold thickness. Then you have go to the heart, intracardiac echogenic focus. Then go to the aberrant the branches of the aorta, aberrant right subclavian artery. Then go to the bowel, hyperechogenic bowel. Then go to the kidney, mild hydronephrosis. Then go on to the bone. So very easy to understand. If you start from brain, okay, if you start from brain is, if you start from head to toe, this is the brain is ventriculomegaly. Then you have to go to the knuckle fold, absent nasal bone. Then the face means there will be absent or hyperplastic nasal bone. Then you go to the back of the head, that is knuckle fold thickness. back of the head. If you go down from the like head to toe, if you right, then intracardiac, then you go to the heart, intracardiac echogenic focus, then you go to the branches of the subclavian artery, arsa, right, branches of the artery, then in the sixth you go to the bowel, the hyperechogenic bowel, then you go to the kidney bowel, then kidney, that is mild hydronephrosis, then you go to the short humerus bones of the upper limbs and lower limbs. So very important how to remember. I will tell the tricks, very 8 points. So basically this 8 point I will discuss here. I will write here the 8 points. 8 head to toe. If you go down, then you get all the submarkers. Head, if you start brain, you will get ventricle, ventriculo, megaly. Then after you go to the face, there will be absent nasal bone or hypoplastic nasal bone. Then you have to go to the heart. You have to go to the back of the head, that is your increase knuckle fold thickness. Then fourth, you have to go to the heart, then in intracardiac echogenic focus. Then fifth may you got the branches, the branches of aorta, branches of subclavian artery, that is aberrant right subclavian artery. Then sixth, you go to the bowel, echogenic bowel. Seventh, you go to the kidney, there will be a hydroureteronephrosis. Then you go to the both upper limbs and lower limb, that is short humerus and femur. So very easy to remember. I will give the tricks. Start from the head, go to the down. Head is brain, ventricular megaly, face is absent, nasal bone, hypoplastic nasal bone, back of the head is your knuckle front thickness. Then go to the heart, echogenic cardiac focus in the intercardias. Then go to the that is your branches of subclavian artery, aberrant right subclavian artery. Then go to the bowel, echogenic bowel. Then go to the kidney, multiple hydronephrosis. Then go to the both upper and lower limb, short humerus and femurus. So I'll show the pictures. You can see this is the first is your knuckle fold thickness. Second is your intracardiac echogenic foci. This is the absent nasal bone in the fourth one. Okay, this is the absent nasal bone. This is your echogenic hydronephrosis in the kidney. Then this is the ventricular megaly. This is the aberrant right subclavian artery. So likelihood ratio of the among the all these submarkers, the very important point is your knuckle fold thickness, that is more than 6 mm. The likelihood ratio is 53.1. Very important question they can ask in every exam. Mild hydronephrosis, the likelihood ratio is 6.8, echogenic foci is 6.4%, short humerus femur is 7.9%, measured defect is 33%. But knuckle fold thickness, very important statement. You have to remember the calculations for the risk of trisomy. The likelihood ratio, based on the likelihood ratio, the chances will increase. The likelihood ratio of the knuckle fold thickness, if it is more than 6 mm, very important. If you get, then it is the likelihood highest. Again I tell cardiac echogenic focus, then echogenic cardiac focus, ventricular megaly, increased knuckle fold, echogenic bowel, mild hydronephrosis, short humerus, short femur, aberrant right subclavian artery, absent or hyperplastic nasal bone. So very important. Please subscribe if you like this channel. Thank you.